wanted to start my private practice, and St. Mary's Hospital made me a deal. They said to me, you know, you'll have immediately over 600 patients because our staff will come to you. So I said, that sounds great.
We wanted to have a practice that was big enough to serve all areas of the city itself and also reach down into Petersburg and Colonial Heights. And then the four of us built this, and Winston Trice joined us shortly thereafter.
I think that VEI heading forward in the next 50 years, what excites me is that they will be there on the cutting edge of whatever's going on, and that they will maintain the quality of what has been done in the past.
The most proud, I think, comes not so much from the pictures on the wall of those of us who started out, what little accolades some of us might have had, but seeing the really strong individuals who have been attracted to come and practice with us.
I think what makes VEI so special is the depth of the specialties, especially in terms of hearing and eye and even aesthetics. You can come to VEI for whatever ails you in terms of all those conditions, and it's very unusual to have that all under one roof.
Everybody in town that wasn't us was sure we were going to go bankrupt, and we didn't. So we showed them that we could do it, and we did. I've been retired for almost 10 years, and I don't even know many of the new doctors that VEI has replaced us old guys with, but apparently we're doing quite well. Most of the people in the waiting room out here are smiling, either sitting in the chairs and when they're leaving, which will tell you how well you're doing.
I think that the most important thing is that there's a great deal of personal interaction between the physicians and not only the patients, but the staff. If I had to give credit to anyone, as much as I get along great with the physicians, the real credit goes to the staff.
I have been retired for 5 years now, but when I retired, the staff, excellent. And I mean, like I told you, they were like my family. And they're just excellent staff that cares about the patient, which is the most important thing of all.
I first felt proud to be working at the Virginia Eye Institute. Actually, when I started, started working with the people and the patients, and it just felt like a family atmosphere.
A lot of my friends come to the Virginia Eye Institute, and we treat their kids, their parents, even their grandparents. So it's 4 generations of patients come through here. Friends of mine, friends of friends. We treat everyone from 2 years old, 1 2-year-olds to 99 to 100-year-olds.
When you have someone that's 101 walking through the door and just able to tell you that you're doing a great job, to see that, it brings light to your day, and to see that we're still providing care to them.
When I first came to Virginia Eye Institute, when I met the people here, I knew I was in good company. There's a genuine culture of caring here, not just about the outcomes, but about the people themselves. As an audiologist, I've always practiced and wanted to treat my patients as though they're my family members, and working for a company who held those same values and beliefs was really important to me.
I've been with the company as long as I have because I believe they have a great culture for their employees, and they have a number of employees that have been here for a multitude of years. We're talking like 25, 30, 45 years, which I think speaks highly of the company in and of itself.
We're celebrating Virginia Eye Institute's 50th anniversary, which is kind of hard to believe that a medical practice has survived that long. We take great pride in recruiting great physicians, and so it's kind of a continuum of we have some doctors retire and we just replace them and grow with great new physicians, and so we've managed to keep our tradition of clinical excellence going for 50 years, and we're quite proud of that.
I just think that when Virginia Eye Institute was conceived, I think that there were some basic fundamental building blocks put into place that have stood the test of time, and I think a lot of that's having good quality, but I think also being patient-centric, and I think those are the two main things in medicine, right? And so if you do those well, then you're going to stick around. I think we've built upon that as well.
We're always looking at ways to improve, and we don't put patients in a box. Everybody is an individual person. Everybody has a specific problem, and we're here to treat the person as a person and not just a number coming through the door.
It's great to celebrate 50 years of history. It's great and incredible what Virginia Eye Institute has been able to do over the last 50 years, but just as important is looking at the future, and we have done everything we can to position ourselves so that we have the best technology, the best people to provide that current success into the future for Virginia Eye Institute.
I think we'll continue to grow along the lines of the forefront of ophthalmology, maintain our individuality, that we're not bought by someone telling us what to do. I think we'll be around for a long time.